All right, so we are going to talk about cardiovascular drugs today, and the discussion will be related to the drugs and in relation to NCLEX exam, right? So the very first thing is, first of all, we need to learn about the phenomenon of blood pressure. We have already talked about how blood pressure works and what is the formula of blood pressure. Why? Because this is really important to know. All these medications that we are going to discuss are going to work on this formula. Uh, so the first thing is blood pressure is equal to cardiac output multiplied by total peripheral resistance. So last time we talked about what is peripheral resistance and what is cardiac output. Then cardiac output is further uh, known as stroke volume multiplied by heart rate. So if first of all, let's see the cardiac output. So cardiac output is defined as the amount of blood that is ejected by the heart in a minute, right? So in each minute, the amount of the blood that is ejected by the heart is cardiac output. So these two things will combine to make cardiac output. One is stroke volume and the other one is heart rate. So greater the heart rate, greater the cardiac output is. Greater the stroke volume, greater the cardiac output is. So if the cardiac output is higher, the blood pressure will be high. If total peripheral resistance is high, the blood pressure is gonna be high. So you guys know very well about cardiac output. Now, what is total peripheral resistance? This is actually the resistance that is created by the blood vessel against the blood ejected by the heart. So if this, let's suppose this is a vessel. If this vessel is larger, the diameter of the vessel is larger, the resistance will be less, right? If the diameter is less, like this vessel is narrowed, the diameter is going to be short and resistance is going to be high. So whenever there is high resistance, there will be high blood pressure. So this is really important to understand the formula of blood pressure, how the concept of blood pressure is, and why? Because all these medications are going to work on this. So that's why it's really important to know that. The next thing is we need to know about the adrenergic receptors. As we talked about sympathetic nervous system and parasympathetic nervous system in our previous session. So this is the division of the sympathetic nervous system. And these are the receptors. These receptors are located in body in different areas. So I'm going to talk about the location of these receptors in upcoming slides. So what's the classification of adrenergic receptors? These are alpha receptors and beta receptors. Alpha receptors are further divided into alpha 1 and alpha 2, and then beta receptors are divided in beta 1 and beta 2, and somewhere there are beta 3 as well, right? But because we are going to discuss the things in relation to the heart, so these are most important things, right? So you need to remember these receptors and then their activities. Here I would like to explain to you about two other concepts. These are antagonist and agonist, right? Agonist means uh, anything or any drug that is going to increase the activity of these receptors. They are called agonist, and antagonist are those drugs or agents that will decrease the activity of these receptors. So you need to remember these terms as well. agonist and antagonist, right? The third concept, which is really important to understand these medication, is the concept of renin-angiotensinogen system. In fact, this is renin-angiotensinogen-aldosterone system. So how does this system works? Whenever there is a decrease in the blood pressure, or if there is a decrease in volume, this volume can be decreased by any factors, maybe because of hypovolemia due to injury, or if there is any open wound, there can be hypovolemia, or this can be due to electrolyte imbalance. If a person is having nausea or vomiting for a longer period of time, maybe he or she can be depleted for volume. So if there is a drop in blood pressure or decrease in volume, what are the compensatory mechanisms? The kidney will release renin, right? So renin is going to be released from kidney, and in the liver, there is an angiotensinogen. So this is an enzyme, right? So this enzyme will be converted into angiotensinogen 1 by renin. So after the enzyme is converted into angiotensinogen 1, this is going to go in the lungs, and there will be release of angiotensinogen converting enzyme from the lungs. So this will convert angiotensinogen 1 into angiotensinogen 2. So what are the functions of angiotensinogen 2? It's gonna go and work on adrenal gland. So angiotensinogen 2 is going to stimulate adrenal gland, and adrenal gland will release aldosterone. The other function of angiotensinogen 2 is that it directly affects on the blood vessels, and it will cause vasoconstriction. And in response to vasoconstriction, there will be increase in the blood pressure. And with the release of aldosterone again is going to, absorb the salt and water in the kidneys, so that there should be increase in the blood volume. So ultimately, the body is trying to improve or increase the blood pressure, right? So this is the mechanism that we need to understand. Why? Because we have medicines called as angiotensinogen or ACE inhibitors. These are the medications that we use for blood pressure. So this slide shows different receptors and their location. Like beta receptors, they are in heart, they are in kidney, like in lungs, blood vessels, GI tract, bladder, uterus, liver, and then, as I said, beta 3, but we are not gonna go anything with this. So how you can remember, this is one way to remember, like where the beta 1 receptors are located. They are located in heart. And so why? Because there is one heart in the body, so beta 1 1. So you can relate 1 with 1. So beta 1 are in heart and beta 2 are in lungs, right? So these are there are two lungs in the body, so beta 2 are in the lungs. Why it is important for the why it is important for us to know about these receptors? Because their stimulation will cause a different action in different organs of the body. For example, if we give beta blockers to a patient, his or her heart rate can be reduced or will be reduced. But if the action of those drugs in the lungs will be different, like they will cause bronchoconstriction. So with the constrictions of the bronchi, the patient may have difficulty in breathing if that patient is already a known case for asthma or COPD. That's why we need to be very careful when we are giving beta blockers to patients with asthma or COPD. Right, so this is the significance of understanding of these receptors and what's gonna happen to a patient when we'll give beta blockers or beta agonists. The other receptors that we are talking here are alpha receptors, right? So these receptors, these are the locations you can see where we can have these receptors in the body, like blood vessels, people, pylorus, urinary sphincter. So these are different locations where you can have these receptors. Now, this was the basic concepts that we need to understand before we talk about the cardiac drugs that are important for NCLEX exam. So this slide shows the classification of drugs. These includes antihypertensive, diuretics, antiarrhythmic drugs, vasodilators or drugs that cause vasodilation, anticoagulants and antiplatelets, though these are not directly gonna affect on blood, but these are important medications and many cardiac patients use these medications, anticoagulants and antiplatelets, especially with coronary artery disease and those with myocardial infarction. And then cholesterol lowering drugs. So these are different drugs that we are going to talk about, and we really need to understand what are their mechanism of actions and what are the nursing care that we need to know regarding these medications, because you will have so many questions from these medications in your NCLEX exam. So let's move forward and let's talk about these drugs one by one. So the first class is antihypertensive drugs. In antihypertensive drugs, there are different drugs including ACE inhibitors, beta blockers, and calcium channel blockers. What are their mechanism of actions and what are the example drugs? Like in ACE inhibitors, whenever you see any medication with a suffix or a medication ending with the word pril, you can remember that this medication is an ACE inhibitor, right? So these, you can see the examples here: lisinopril, enalapril, captopril. So all these medications, that their names are ending with pril. So anything with pril is ACE inhibitor. How they work? They block angiotensinogen, enzyme, and they block the conversion of angiotensinogen 1 into angiotensinogen 2, so leading to the dilation, right? So they decrease the blood pressure. What are the nursing consideration for these medications? Like a patient taking ACE inhibitor, uh, you need to monitor potassium, right? There is a risk for hyperkalemia, and you need to avoid these medications in pregnancy and watch for dry cough. These are important. NCLEX is going to ask you about these questions, and you can see that uh, I have given you these questions in the pre-test for your knowledge. Why we need to monitor potassium? Because ACE inhibitor will, retain potassium. They will retain potassium. So if there is a retention of potassium, the patient can go into hyperkalemia. The other side effect of ACE inhibitor is these are teratogenic, right? They can adversely affect the development of a baby and also damage the baby's kidneys, right? And the other side effect is dry cough. So if there is dry cough, you can take it normal because this is a normal side effect of ACE inhibitor. But if this is worsen or if this is bothering a patient a lot, then you need to report to a healthcare professional. The second category is beta blocker and the drugs ending with lol, right? We use this word in our routine English conversation like lol, laughing out loud, right? So this is we use. So you can remember it with these uh, acronyms or whatever you want to call it. So drugs are metoprolol, atenolol, propanol. So you can remember these like this. How they work, like block sympathetic nervous system, decrease heart rate and decrease blood pressure, and then ultimately they decrease the cardiac workload. What are the nursing considerations? Check heart rate, hold if less than 60 beats per minute. Avoid in asthma, non-selective beta blockers. As I explained you in the previous slides, if you are going to give them non-selective beta blockers, they will cause the constructions of bronchi, ultimately worsening the asthma and COPD. So these are the conditions that you need to remember, and NCLEX is going to ask you these questions. And finally, calcium channel blockers in this category. The drugs names are amlodipine, nifedipine, diltiazem. So they block calcium channels in heart, so leading to decrease in blood pressure and slows the heart rate. Avoid grapefruit juice with the calcium channel blockers and monitor blood pressure. Watch for edema. Why grapefruit? Because if you give a patient grapefruit, it will interfere with the drug, and it will inhibit the activity of an enzyme which is CYP3A4. So that is an enzyme that is important for liver function and other functions in the intestines. So you need to remember these. The next category is diuretics. In diuretics, we have loop diuretics, we have thiazide diuretics, and potassium-sparing diuretics. These are the example drugs. You can read them. And then their mechanism of actions, like loop diuretic inhibit sodium and potassium absorption in the loops um, in the kidneys, and that's why they causes diuresis. With these drugs, we need to monitor potassium because there are chances that these drugs will cause hypokalemia. And given AM, watch for ototoxicity, right? Why we need to give them in morning? Because if you give these medications in evening, the patient won't be able to sleep just because he or she will have the urge to urinate. And then thiazide diuretics block sodium absorption in distal tubules, decrease blood pressure. With these drugs, we need to monitor electrolytes, can cause hyperglycemia. With potassium-sparing diuretics, spironolactone is one of the major drugs in this category, block aldosterone and retains potassium, loses sodium and water. And then we need to monitor potassium again because this is potassium-sparing diuretic. This can cause hyperkalemia. Avoid potassium supplements and diets that are, rich in potassium or high in potassium. Then the other category is antiarrhythmics. In antiarrhythmics, we have amiodarone and digoxin. Uh, what is the mechanism of action of amiodarone? It prolongs repolarization and slows heart rate and stabilize arrhythmias. We need to monitor ECG, avoid sun exposure, and watch for lungs or liver toxicity. So these are the things that you need to remember, or you need to memorize few of their side effects or special considerations with these medications. Digoxin, really important drug for patients with heart failure. There are three important concepts that you also need to remember. These are chronotropic, dromotropic, and inotropic. So any drug, your inotropic is related to contraction of the heart. Right. So this drug, digoxin, enhance the contractility. It is positive inotropic and negative chronotropic. Chronotropic is related to heart rate. So digoxin decreases heart rate and increases cardiac contraction. So that's why it will, you know, improve the cardiac output and decrease the tachycardia in heart failure patients. So what we need to um, what we need to do, or what are the nursing considerations? Check apical pulse. So we can hold this medication if the heart rate is less than 60 beats per minute. Monitor digoxin toxicity. With toxicity, you can have symptoms like blurred vision uh, and nausea or bradycardia. So these are the nursing consideration, and then NCLEX can ask questions about these things. Then the second, or the other category, not the second, but the other category in these medications are vasodilators. We have nitrates here, nitroglycerin. We can have GTN, triglyceride, nitroglycerin, or di-1, right? So what they do, they dilate coronary arteries, or they increase the diameter, they reduce the resistance, right? They decrease the total peripheral resistance and increase oxygen supply to the heart and the other cells of the body. What we need to be careful about, patient need to sit before taking, store in dark containers, maximum 3 doses, 5 minutes apart, and watch for hypotension and headaches. Then anticoagulants and antiplatelets. We have heparin here, warfarin. Important medications for heparin. The drug examples are heparin itself and enoxaparin, which is low molecular weight heparin, right? And they prevent clot formation. We can give IV and sub-Q, and most of the time we give these medications subcutaneously. What are the consideration? We need to monitor APTT with the heparin and watch for bleeding. Antidote for heparin is protamine sulfate. You need to remember these uh, concepts so that you don't forget or confuse in your exam. And with warfarin, we need to monitor INR, the normal range. We want to keep it within 2 to 3, and anything above or below is concerning thing. Avoid high vitamin K foods. Why? Because vitamin K is the antidote for warfarin. Okay, and then aspirin and clopidogrel inhibits platelet aggregation, and we need to monitor for GI bleeding and bruising with these medications. And then the cholesterol lowering drugs are statins, and we can remember them with the statin. So atorvastatin and simvastatin, they lower LDL and raises high density lipoproteins and monitor liver functions. With statins, liver function, and liver functions, right? You need to remember these. And again, we need to avoid grapefruit juice. Watch for muscle pain. Why avoiding grapefruit juice? Grapefruit juice, as I said, it will interfere with the drug function. Uh, it will inhibit the activity of CYP3A4, and then it can cause the toxicity, or it can enhance the drug level, ultimately, causing the toxicity, or patient can go in liver failure. So what are the NCLEX tricks that you need to remember? You can call them mnemonics, you can call them acronyms, you can remember these, you can write these with you, and you can just memorize these. With ACE inhibitors, the key is ACE. For A, it is angioedema. Serious side effect like uh, angioedema, your tongue can be involved. In angioedema, there is the collection of the fluid under the tongue or in other tissues in the body. You can have a cough, which is dry persistent. With ACE, this is normal, but if it is too much, if it's bothering, you need to consult with the physician. And then E for elevate, potassium, hyperkalemia, right? So we need to be careful about this. For calcium channel blockers, it's very nice. You can remember, very nice drug, right? So for very is verapamil, nice is nifedipine, and drug for diltiazem. So these are the drugs in calcium channel blockers. For beta blockers, LOL is the suffix, and then beta, you need to remember it beta, or in Urdu or Punjabi we can say, in Urdu we can say beta, right? So for B is bradycardia, like hold if heart rate is less than 60. E for exacerbate, bronchospasm, avoid in asthma or COPD. It can cause tiredness, fatigue, and dizziness, and then attenuates and mask hyperglycemia symptoms you can, hypoglycemic symptoms you can observe. So for calcium channel blockers, the side effect is hypotension, edema, constipation, and then again we need to avoid grapefruit juice. Okay. And then with the digoxin, the other important thing we need to remember, ATP. Watch for toxicity. A for apical pulse, hold if pulse is less than 60, and we need to watch for toxicity symptoms because its therapeutic index is very narrowed. Its therapeutic levels range between 0.5 to 2 nanogram per ml. Okay, so for P is like potassium, very carefully. We need to be very careful about potassium for patients who are using digoxin or who are taking digoxin. Hypokalemia increase the risk of toxicity. So we need to monitor the potassium levels. And then for anticoagulants, heparin or heparin versus warfarin. Like for heparin APDD, we need to monitor, um, at activated partial thromboplastin time, and protamine sulfate is antidote. For warfarin, we need to look for INR, PT-INR, and if it is between 2 to 3, that's okay. Other than these values are concerning thing. Watch vitamin K intake. Why? Because if a patient is taking a diet high in vitamin K, it's not gonna work. And then heparin is short term, and warfarin we use for long term. Like if there is a valvular replacement, we put patient on warfarin. And for statins, we need to remember statin, which is sore muscle. It can cause rhabdomyolysis. Like if there is excessive level of statins, or if there is statin toxicity, your muscles can, there can be a breakdown in the muscles in the body. That is not a good thing. So we need to take these medications at night, avoid grapefruit juice, toxic to liver, and we need to check LFTs on regular basis. And they increase high density lipoprotein, which is good for your body, and they lower the low density lipoprotein, which are not good for the body. And then we need to monitor for myopathy. Right, so this was all about this drugs. I'm going to stop recording here, and then I can take your questions.